Hello, good afternoon. I'm Dr. Chidiebere Agbakwuru, a consultant clinical and radiation oncologist at the NSIA-LUTH Cancer Centre, and I'm here to talk about childhood cancers. Today, February 15th, being the commemorative day for International Childhood Cancer Awareness, it's a right time for us to have conversations about what we're doing here, what we've done in the past, and what we hope to achieve in terms of childhood cancer. So this year's theme, Inspiring Action, is very important because we have to build on the insights gathered from last year, from all the experiences of all the caregivers and the parents and the guardians of the children and adolescents who were treated for these malignancies. It's important to put together actionable solutions, and these actionable solutions may come in form of innovation, may come in form of collaboration with other centers. This year, one of the things we're looking at mostly is innovation, looking at our unique environment and finding what works for us, because in several regions you have greater availability of resources, and in some other regions you have a large paucity of these resources. So innovating around how we can make the little we have work for us. For example, in managing a child with a malignancy that needs radiation, you would need several subspecialists. You will need an anesthesiologist, you will need a play therapist, you will need an endocrinologist, you will need a social worker, and you will need a radiation oncologist. You also need oncology nurses. So it's important to ensure that we build a system that works, despite the fact that we know that these healthcare workers are in very, very short supply. So now, in terms of pediatric radiation oncology, it's very dear to everyone at the center, from the radiation therapists to the medical physicists and the radiation oncologists, and even the management. There's usually a special discount for children undergoing radiation oncology. There's usually priority and concession given to children undergoing radiation oncology, and the teaching hospital at large usually converges around such cases. It usually strengthens our multidisciplinary efforts to ensure that there's holistic care for the child, from the anesthesiologist evaluations to the endocrinologist assessments to even the social worker prolonged intervention, even during follow-up care. So I think it's important that as the 3-year theme draws to a close, and right now we're in the middle of it, it's important for us to build on what we found out and be able to showcase our results next year, so that as other countries are tapping into the available resources that are free on the CCI and the SIOP websites and building up their clinical capacity, then Nigeria doesn't get left behind. And it's important that all experts in the pediatric field, in the radiation field, come together to understand what the unique challenge is and build a most robust multidisciplinary approach to this. I'm calling on donors, I'm calling on clinical experts, I'm calling on philanthropists, I'm calling on policymakers to put hands together to ensure that the Nigerian child doesn't have worse outcomes or separate outcomes from their counterparts in mainland Europe or in America. Thank you very much.